Facelift confusion. There's so many different options. It's very difficult for people to figure out what they really need to know, but we're going to tell you what you need to know on Hey Doc. Hey Doc audience, Haute Beauty published this Exploring the Palette of the Face and Neck Lift Rod, and they gave a guide to 5 options for timeless rejuvenation. So what is this bogus? I mean, what do you think?
Well, Bill, I mean, I read it, and it's got these 5 different groups, and we go through them all, you know, from the mini facelift to the direct neck. But I think they may confuse the viewer and the consumer more than anything else. And there's so many ways to disguise a facelift. But let's talk about this. So the first one is the mini facelift. I have never understood what a mini facelift is. Is it done by little surgeons, or I don't know? You know. Like a mini tummy tuck. What is a mini tuck? Or like a mini breast lift? I don't know. Do you understand that? I've never understood a plastic surgery procedure where they put mini on there. Didn't really do anything, and maybe it looked good for a few days. So a mini result. So I think a mini facelift is kind of a myth and really doesn't tell you anything. Then the other one is the mid facelift. Well, the mid facelift was something that was fairly popular in the 90s, but the classic mid facelift really didn't turn out well, because if everything was suspended from your lower eyelid, that did not turn into a good result. So I would do thumbs down on that too. In general, that's not a good idea to suspend your whole cheek to your lower eyelid area. Then the traditional facelift. Well, what does that mean today? I mean, today everything from the deep plane to the smash. And I think that's the 2 things you need to know. The deep plane is really a form of a deep layer facelift. The smash and the deep layer, I know there are critics that talk about one is better than the other, but no one's ever shown that they're better. It's another trending fad, and we've actually been doing this for several decades. So I think the most important thing people need to know is that you should lift the deeper layer, and you should lift it more vertically if you can. And then centrally, you should add fat. That is the prescription for natural facial rejuvenation. So that's a good thing, a lift and fill type thing. The short scar facelift is the 4th one. Again, that's just the incision. It's not a swift recovery, because you're basically trying to do an entire facelift with a short scar in front of the ear and then not going behind the ear. I think, again, that's more of a marketing ploy. It's really only indicated in a small group of patients that don't have a lot of neck jowls and have more laxity over cheeks. So I don't think that's significant. You're supposed to do this whole operation, which is the deep layer with it. And then the last one is a direct neck lift. I mean, that's a limited incision where you do like a Z-plasty, and you do it in older or more mature patients, or patients that don't want the other scar. So I think that's reasonable, but that's a small group of patients that you do it on. So I think this is a palette that may be a little bit skewed and a little bit confusing. But if you just basically find a board-certified plastic surgeon or a facial plastic surgeon that's an expert in facial aging, understands the science of aging, there's a good chance you're going to have a greater outcome, and that's safe. And I think that's what you need to do. Kind of know before you go, Bill.
You typically don't just break things up into, rote, like
No.
they're mini, because sometimes there's gray areas between those, right? And you're customizing it for a given patient where their aging is.
Absolutely, that's right, and that's a good point, Bill. Every face is different, so you customize the facelift. You don't just say, I'm the deep facelift guy, or I'm doing a smash. That's not what you do. You do it based upon what the patient really needs from their aging process. It's always different.
Yeah, and I think your point about these things that are mini, sometimes it caters to people's just normal sentiment that, if I can do something with less is more, and I don't have to do as much, or recovery won't be as much. But oftentimes when if you only have a hammer, then the whole world looks like a nail, and we all know that's not good.
Right, and it's a marketing. So many times when you hear mini, it's like a marketing ploy. How many patients have you seen that need a mini tummy tuck? Very few. Or it's not a good term, and it really doesn't describe what you really do most of the time.
All right.
Know before you go.
All right, great info. The truth will set you free. But if you like this, check out this video on the truth about liquid facelifts.